Thanks again for joining us today. Again, in the Legislative Building in Regina, we have Minister of Health Paul Merriman and Dr. Saqib Shahab. Joining us on the phone line is SHA CEO Scott Livingstone. Both the minister and the doctor will have opening remarks, followed by time for questions.
Good afternoon, and thank you for joining us today. I want to start by expressing my deepest condolences to the family and friends of the individuals who have passed away in the past few days due to COVID-19. Our thoughts and prayers are with you at this difficult time. Our new case numbers in Saskatchewan have continued to drop over the past week. This may be partially due to fewer people getting tested over the Christmas holiday. But the new case numbers have definitely been trending in the right direction over the past couple of weeks. On December 12th, the 7-day average for new cases peaked at 292. Today, the 7-day average is down to just over half that number of 152. And the number of active cases have dropped below 3,000 for the first time since November 24th. These case numbers are still much higher than we would like, but they are trending in the right direction. The restrictions that we have in place are working. So I want to thank everyone in Saskatchewan for continuing to follow all of the public health orders and guidelines, particularly over the holiday season. I know this is not the kind of Christmas that we were used to, but I hope everyone was still able to find ways to celebrate and connect with family and friends, even though we couldn't get together as much as we would have liked to. But again, these restrictions are working. Our case numbers are dropping. And because of the collective efforts of everyone in Saskatchewan, we were able to keep most businesses open, most services and activities open, and most people working, while still controlling and even reducing the spread of COVID-19. So again, thank you, Saskatchewan. We continue to move forward on the path out of this pandemic, which is our vaccination program. We have now administered nearly 3,000 first doses of the Pfizer vaccine to healthcare workers in Saskatoon and Regina. And this afternoon, we have received our first shipment of Moderna Vaccine here in Saskatchewan. The Moderna vaccine can be transported and stored easier than the Pfizer vaccine. So the first doses of Moderna vaccine will be sent to northern Saskatchewan, where it will be given to long-term care home residents and staff and other priority healthcare workers. We also expect to receive more doses of the Pfizer vaccine in Saskatoon and Prince Albert next week. Dr. Shahab will have more to say in a moment about how these vaccines will be deployed. While our vaccination program has been going well so far, these are still relatively small numbers of vaccines that we have received from the federal government. We expect the federal government to begin receiving and distributing much larger numbers of vaccines early in the new year. We are trying to get a clear indication from the federal government of the number of vaccines they will be sending us each week, so we can better plan for the next steps in our distribution process. This is a challenging vaccination program to put together, given the complexity, the scale, and the differences in storage and transportation required for the different kinds of vaccines. Saskatchewan is absolutely prepared to meet this challenge, but we need the federal government to provide more clarity than they have been about the numbers of vaccine doses we will receive over the next few weeks. As I said before, Saskatchewan has a great track record when it comes to immunization. So we are ready to administer all of the vaccines we get as soon as we receive them. This is how we will protect Saskatchewan people from COVID-19 and move past this pandemic. But until then, please keep following all of the guidelines and public health orders to protect yourself and those around you. Again, thank you, Saskatchewan. Dr. Shahab?
Thank you, Minister. So I'll maybe walk through some slides to to update further to the minister's update on where we are with the immunization program, and then just go over some further key messages. So, in terms of our vaccination update, so the initial vaccination program started December 15, so we're just finishing our second week, and 1834 vaccines have been administered, and the remainder will be provided to long-term care staff at Regina Pioneer Village and Santa Maria care homes, so that's good. In terms of Saskatoon, 3,900 doses of Pfizer vaccine were delivered December 21st, an additional 975 doses this week, of which 1,108 have been administered. So again, vaccinations are proceeding on a regular basis in Saskatoon. And of course, like the minister mentioned, we're really happy to announce that starting next week, Pfizer vaccines, 3,900 doses will be arriving in January 4th. And, similar to Regina and Saskatoon, obviously, healthcare workers providing ongoing regular care to COVID-19 patients, staff who work in long-term care facilities and personal care homes, and residents will be vaccinated in Prince Albert starting next week. So all good news in terms of the Pfizer vaccines. And then we are looking forward to further delivery of the Pfizer vaccines. We, at this point, are aware of about 6,825 doses to be delivered weekly in the months of January. And of course, the Pfizer vaccine has to be stored at below minus 70 degrees. So that's why Saskatchewan has procured 5 ultra-low temperature freezers, which are currently in place in Saskatoon, Regina, and Prince Albert. And a further delivery of 4 ultra-low temperature freezers is expected. So again, the Pfizer vaccine requires minus 70 and below, and requires special freezers that are in place in Saskatoon, Regina, and PA, and further freezers are expected as we branch out the Pfizer vaccine program throughout Saskatchewan. And the Pfizer vaccine will, expansion of the Pfizer program, vaccine program will permit healthcare workers, but also long-term care and personal care residents and staff in more geographic areas to be able to access the Pfizer vaccine. And then the second vaccine that's approved for use in Canada is the Moderna vaccine. So as Minister mentioned, 4,900 doses have arrived today. This vaccine requires minus 20 storage, so easier to move and store. And initially, this will be going to the far north central and far northwest parts of the province. This is where we've had high number of cases and high test positivity rate. And then initially, about half the doses will be sent and distributed. Again, the redistribution is quite complex in the far north, so all of that has been worked out, and that will start this week and next week. And then as the vaccines are used, further shipments will be sent from Regina to the far north. So the weeks of January 4th and 11th, vaccination with the Moderna should commence. And again, the priority will be on populations at high risk, including long-term care residents and staff, personal care home residents and staff, and frontline healthcare workers providing ongoing regular care to persons with COVID-19, as well as staff working in COVID-19 testing and assessment sites. Of course, for the far north, there's ongoing communications with local leadership to facilitate notification of clinic dates, locations at the community level, and information about vaccine safety and efficacy, as well as radio spots in English, Cree, Dene, and Michif, social media advertising, and working with healthcare providers in the Saskatchewan Health Authority and Athabasca Health Authority. So again, there's a lot of work, pre-planning work that's already happening, and as the vaccine rolls out, obviously the far north covers a vast geographic area, and so the logistics and details of distributing the vaccine, setting up clinic dates, and informing people who are eligible for vaccination at this time is ongoing. So with that, I think it just kind of just highlights that we have based on the vaccine we're getting, we're able to start distributing the Pfizer and now the Moderna vaccine to different parts of the province, including the far north. and starting the vaccination program with both Pfizer and Moderna. And then just to go over some key messages, obviously I'll join the minister in expressing my condolences to the people who have passed away since our last media avail. So 29 Saskatchewan residents have died, and our thoughts are with the family and friends and the staff who cared for them, for those who were in long-term care facilities. Like the minister said, all the information I got from friends and colleagues throughout Saskatchewan was that it was a quiet Christmas. People celebrated and connected with friends and family virtually on Christmas Eve, on Christmas Day, but a lot of people were out and about. The weather was mild, and it was great to see families outside greeting friends and neighbors and family members. And similarly, Christmas, New Year's Eve, and the New Year long weekend seems to be milder in terms of weather. So again, the message remains the same, that ring in the new year safely, limit yourself to your household, connect with friends and family wherever they are virtually, and of course the long weekend has mild weather, so it's really great to see people taking advantage of the mild weather and being out and about. The risk obviously outdoors is lower, as you can gather in groups up to 10 and while maintaining physical distance. And again, when we look at our numbers, while our overall numbers have been trending lower, our test positive rate still remains high, between 7 to 9%, and that shows that while we're obviously very happy that our overall daily case numbers have remained stable, the test positive does show that there is a bit of a concern. And again, I would encourage anyone with any symptoms to do seek testing, because then that informs you in terms of isolation, and your close contacts can start isolating. That is going to be important throughout the holiday season, and of course as we start the new year, that is going to be very important to continue those practices. Our hospitalization numbers also, there's a bit of an adjustment, but they have remained stable for the most part. We haven't seen them increasing, but there is a 1 to 2 week lag, and so we'll be monitoring that closely first 2 weeks of January to see if there were any increase in cases beyond what we are able to see at this point, that are reflecting in not just the high test positivity rate, but also an increase in hospitalizations and ICU admissions. But obviously, again, we have to recognize that while many of us were able to take some time off over Christmas and New Year's Eve, our friends and colleagues in the health system have been working throughout the holidays, vaccinating, preparing for vaccine logistics, doing case contact follow-up throughout the holidays, and of course, caring for patients in hospital and ICU. So finally, I'll just say, like the minister said, that we have a robust vaccination program. We are getting regular small amounts of vaccine on a weekly or bi-weekly basis, both Pfizer and Moderna, for the next 3 months. While this vaccine is essential to protect the most vulnerable, and as vaccine supplies will improve over March, April, May, it is really important that we continue practicing all the good things we've been doing so far. It's kept our case numbers low. It's allowed us to do many things related to work or leisure activities in a safe manner, and I think we really need to continue that through the rest of the holiday period. And as we go back to work and school, again, continue to work from home where you can. If you are working in a workplace, follow all the COVID-19 guidelines, including careful about interactions with colleagues in the workplace at break times, and similarly revisiting all the good practices we had when going back to school. Not going to school if your child is unwell, seeking testing and further guidance, and obviously employing all the layers of protection at school or work, including physical distancing, hand hygiene, and mask use. Thank you very much.
Thank you, Minister. Thank you, Doctor. We'll start with our first question from the phone line, operator.
We have Stephanie Taylor with the Canadian Press.
Hi, this is for the health minister. At a time when Saskatchewan residents are being told to stay at home, how appropriate is it for your colleague to be in California, even if he says he is there to take care of personal business in the way of selling personal property?
Thanks for the question, Stephanie. It's not my place to comment on my colleagues' actions. Everyone has their own judgment of what they feel is essential services or essential travel. But what I can say is I certainly didn't travel throughout the Christmas season. I was home with my wife in Saskatoon, and we were able to connect with our family members virtually, which was different this year. But it was certainly nice to be able to spend a few days at home. So.
Follow-up, Steph?
Yes, news from the federal government today about requiring people entering Canada to test negative for COVID. Do you have any information about how that could have potentially applied to your colleague? Like, would he have to test negative before re-entering Canada and ultimately the province?
As far as I know, anybody that's coming back into the province that has been traveling internationally has to quarantine for 14 days. So I would expect that anybody that is traveling outside of our country that's coming back would have to quarantine for 14 days.
We'll take our next question from the room. Lynn?
I think this is probably for Dr. Shahab. You mentioned that we're expecting weekly numbers of Moderna doses too. Do you know how many weekly of those you're expecting to see as well?
So like the minister said, we are getting some preliminary information about allocation of Pfizer and Moderna. The Pfizer supply is more stable, and we are getting weekly allocations of Pfizer. And, I did give you the numbers, but, these numbers are not final, but for the Pfizer, we expect to receive about 6,800 doses a week over January. So that's a stable supply of Pfizer. Moderna, we are getting bi-weekly shipments of smaller amounts over January and February. And then we will get the bulk of our Moderna in March. So Moderna is a vaccine that's easier to transport, especially for the far north. You don't need -70, you need -20. But the amounts we are getting are very limited in January and February, bi-weekly shipments of maybe, a specific amount around 3,000 to 5,000, and then a larger amount in March. But again, these allocations are preliminary and they're subject to change and adjustment.
Follow-up, Lynn?
Yeah, I saw it noted in the slides here too that you're going to be holding back some of those Moderna doses initially. Is that to make sure that everyone who gets the first dose gets the second one, or what's the purpose of holding some of them?
Yeah, so obviously, the Saskatchewan Health Authority, there's a whole team working on the logistics, both with the government and with our federal partners. And for Pfizer, obviously, we had a pilot where everyone learned how to handle the vaccine, ultra low temperature. With Pfizer, it's going to go to, it's come to Regina, Saskatchewan, it's going to go to PA, and has freezers set up to other parts of the province. For Moderna, it's arrived today in Regina. It's easier to transport, but it's going to multiple locations in the far north. So as it's distributed out, the entire amount would be sent. Enough would be sent that we estimate that is required for the first dose at this point. And once that the vaccine is taken up over the next 2 weeks, further amounts will be shipped to points north.
And we'll take our next question on the phone line.
We have Stephanie Davis with CTV.
Hi, is the province concerned about the COVID variant entering Saskatchewan, and if so, what plans are in place to deal with it once it arrives?
Yeah, thanks. So the UK variant, and as we know, there have been 6 cases now in Canada, either linked directly to travel or linked to someone who had traveled. So the positive thing is that all the 6 cases in Canada are linked to travel or to someone who traveled. So they're not, being discovered with no links, which would be more concerning. And like the minister said, anyone who travels has to quarantine for 2 weeks. And I see that the federal government has announced a direction that many other countries have, that prior to departing for Canada, you may require a COVID test as well, which is an extra layer of precaution. But in any case, quarantining for 2 weeks is essential. And of course, our provincial public health lab is able to test and send for genotyping any strain where there's a history of travel to the UK. And they have been looking at those strains over the past month and will be doing so going forward. So if you're symptomatic and had traveled to the UK, you should obviously go for testing. And then based on your travel history, we are able to check for that strain. And so far, we have not found any strain linked to the UK strain in Saskatchewan.
Follow-up question?
Yeah, Dr. Shahab, I know you did touch on this, but just what will the vaccine rollout look like for the general public, just in terms of where they will be able to receive it and where it will be available?
Yeah, so our supplies are very limited January, February, and March, and they are really being directed to the persons who are most vulnerable. So these really are persons in long-term care facilities, personal care homes, and then as supplies allow, persons 80 and over, and then 70 and over in the community, and of course people who care for them, so staff in long-term care and personal care homes, and frontline healthcare providers who care for COVID-positive patients, because that reduces transmission in the healthcare setting. So for the first 2 to 3 months, the vaccination will really prioritize these populations throughout Saskatchewan. But we really are hopeful that starting April, May, there'll be more supplies of both the Moderna and Pfizer vaccines. And as we know, Canada has entered into negotiations with 7 manufacturers. We have heard that AstraZeneca has been approved today in the UK. Canada has a contract with AstraZeneca, so we hope to see that vaccine available as well as potentially other products available, especially starting April. And that's when I think there'll be broader supply, and that's when the vaccine will be opened up to younger age groups and with underlying health conditions initially, and then to the general population. I would estimate June, July onwards.
We'll take our next question from the phone line.
We have Lisa Schick with CJME.
Hi. I'm just wondering, how have you, or if the plans aren't set yet, how will you determine where the doses get sent first and how many, especially because Moderna is a little bit more travelable, I guess, than Pfizer? Like, why one community over another, or why one long-term care home over another?
Yeah, I think that's really important question in terms of sequencing by need. So obviously we only have enough vaccine for persons in long-term care facilities, personal care homes, persons 80 and older initially, and specific healthcare providers who are looking after COVID patients. In terms of where it goes, as we know, Pfizer requires -70 ultra-low temperature freezers. Initially it came to Regina, stayed in Regina. Second shipment came to Saskatoon, stayed in Saskatoon for local vaccination. Third shipment is coming to Prince Albert, will stay in Prince Albert for local vaccination. And as we have more ultra-low temperature freezers deployed, the Moderna vaccine will go to primarily to hubs that can support the Pfizer vaccine. It will go to hubs that can support ultra-low temperature freezers and be distributed for the most part locally. And then the Moderna vaccine is -20. It's easier to transport longer distances, and that's why I think we can be very proud that we are prioritizing the far north as the first part of the province to receive the Moderna vaccine, both because it's easy to transport to remote locations. They're both equally effective, and also because the active case rate and the test positive rates have been highest in the far north. So I think this shows that it's a combination of logistics, but also need in terms of epidemiological data. Minister, would you like to?
Yeah, just what I think it is going to be challenging over the next little while when we go from one location to another and we prioritize one age group. But this is going to be done very strategically. What would be the biggest help in this factor is the volume of vaccines coming into our province. That would change things dramatically on how we can distribute in areas that we can reach. The more vaccines that we have within our province that we get from the federal government will help us be able to even out the playing field, making sure that everybody gets equal distribution of the vaccine.
Follow up, Lisa?
Yeah, I'm just thinking more specifically, like what goes into making those decisions as to where the vaccines go. Like, is it that, for example, there might already be infections in a care home that puts it up higher? Does it have to do with the test positivity rate in that community and in that area more than that? Or does it have to do with maybe there are more people of a higher age or a higher risk in a care home? I'm just wondering specifically what goes into those decisions.
Yeah, so at a high level, I think the vaccine amounts are such that we can't send the vaccine throughout the province every week. So it is strategically positioned in areas where there's initially capacity to handle the vaccine for Pfizer or for Moderna, where there's a higher infection risk, so that is in the far north, high test positive rate and other factors. But of course, locally, it will go to all long-term care and personal care homes in a systematic way and offer to residents and staff in those settings in all the areas where the vaccine arrives. And of course, if someone has had, so the guidelines for immunization are now being posted online to the COVID-19 website. If someone has had COVID illness, they are recommended to wait for 90 days before getting vaccinated because to get the full benefit of the vaccine. But otherwise, even if a long-term care facility has had a COVID case or an outbreak, the vaccine can be offered to residents and staff who did not have COVID illness in the previous 90 days.
We'll take our next question on the phone line.
We have Jesse Anton with CBC.
Hi, I'm just wondering where exactly First Nations communities and correctional facilities fix into vaccination plan.
Yeah. So one of the prioritization for Moderna for the far north actually does reach rural, remote communities, indigenous and non-indigenous. So that is a priority. And obviously, the vaccine will go to all long-term care, personal care homes as the sequencing starts. Regarding correction facilities and other congregate living facilities, as vaccine supplies allow, they will be sequenced along with younger age groups. But obviously, people who are in the eligible age group at this point, 70 and older, in congregate living facilities will be eligible as the vaccine supplies arrive.
COVID numbers and deaths in long-term care facilities across Saskatchewan continue to rise. And it has many people wondering how things got this bad, especially given similar outbreaks, have happened at the start of the pandemic in Ontario and Quebec, and we could have learned from them. Why wasn't the province ready for this, and what would you do differently? And that goes to both of you.
Maybe I'll start with that. I think what we have done historically since this started is we've been making the best decisions with the information that we have on that day. And things are changing so quick on this, and they have been right from the beginning. We're getting information on what had happened in China, then what had happened in Europe and Italy. And the decisions that we made were always with what we had in the best interest of keeping Saskatchewan people safe, keeping our public health system at a level where it's not going to be overwhelmed, and making sure that people are employed and being able to continue their activities. So, and those decisions are made sometimes on a weekly basis, sometimes on a daily basis, and sometimes on an hourly basis to continue to make sure that we're meeting all of those targets of, again, our healthcare system, the employment of people, and the safety of people in Saskatchewan.
Did you want to? Yeah. And I'll maybe also add that, we had very strong protocols right from the beginning, which included staff cohorting, which included screening of all visitors and staff, and obviously some limitation of visitation, which were very hard, and they served us well throughout the pandemic. But we knew that when community transmission rates go high, as they did in November and December, the risk of importation of COVID into long-term care facilities, personal care homes does increase. And and Scott may want to add, but I do want to say that for the most part, staff have worked very hard with great professionalism in long-term care facilities and personal care homes, where a case of COVID has been limited to 1 or 2 residents or 1 or 2 staff. But those are settings where throughout Canada and throughout the world there have been large outbreaks, and unfortunately we have had several now in Saskatchewan. They are actually devastating for staff for whom the people they care for are like their family. They're devastating, obviously, for friends and families of people in long-term care who are unwell and in some cases, unfortunately, pass away. So it has been very hard, but I think that's exactly the reason why it's so important to make sure that as quickly as we can, as much as vaccine supplies allow, we vaccinate residents and staff in long-term care facilities and personal care homes as quickly as we can and as quickly as the vaccine supplies allow. Thank you. And I don't know if Scott had any comments.
Yeah, just a couple comments just to follow up on what Dr. Shahab said, Dr. Shahab has been telling us for months now that what happens in schools, what's happening in congregate living, what's happening in long-term care, personal care homes, and other facilities is a reflections on what's happening in the community. And what we've seen over the last few months is a large-scale community-based transmission and the disease coming into these facilities, despite our best efforts and all those things we did very early on to lock down. Not lock down, but to keep our long-term care residents safe when we weren't experiencing such widespread transmission. But I think just because the vaccine is here and it is that light at the end of the tunnel for us, means it's even more important for us to double down on those things we're doing in long-term care and other types of facilities to ensure that we're minimizing outbreaks. But these are a reality for us right now. We're dealing with outbreaks in long-term care and acute care and personal care homes across the province. And part of our strategy and the slowdown work we're doing on the acute care side is to actually support the staffing needs to ensure that we're testing staff immediately, getting them out of the workplace where we can, taking care of the residents the very best we can as well, and ensuring that we have staff available to do that.
And we'll take our next question on the phone line.
We have Roberta Bell with Global.
Hi, my question is in follow-up to Stephanie Taylor's question about Minister Hargreaves. How difficult does that make it to get people to take that message of stay home, don't go anywhere, we need to all be in this together? How difficult does it to make people take that seriously, having him not in the country right now?
Well, I think everybody has to make their decision on what is essential within their life and what's going on. I think the Saskatchewan people have done an amazing job of adhering to the public health guidelines that we've set out. And we have to remember that these are very challenging guidelines for a lot of people, not being able to visit their loved ones and limiting their travel. Also, some people are unemployed because of this. I think that in general, people have done extremely well. There have been some situations where people have made some challenging decisions. But again, my colleagues, I expect them to make their own decisions on what is essential travel, and no different than anybody else in Saskatchewan.
Follow up, Roberta?
Regarding the long-term care homes, there's been calls now for a public inquiry into what's happened at Parkside Extendicare and Extendicare and for-profit care homes in general. Is that something that you're expecting will be happening in the near future?
It's a good question. I can tell you what I'm really focused on right now is what's happening today, what's happening in the next week and the next month with the vaccine rollout, with our hospitalization numbers. I'm trying not to look back at this moment in time. Will there be a time where I do that? For sure. Right now I have to focus my energy and my staff's energy, as well as the people within the ministry and the SHA and the public health, to be able to focus on what's coming up and what we need to deal with, what's in front of us. And we'll continue to do that in the foreseeable future to make sure that Saskatchewan people are safe.
We'll take our last question from the room. Lynn, do you have a question?
Yeah, you said that people have been having a quieter Christmas, but I'm sure that was not the case for everyone, and testing numbers have also been low the last few days. Are you expecting to see a big spike in cases in a couple of weeks, just like as more people start going to get tested again and because of Christmas gatherings that did undoubtedly happen?
Yeah, so maybe I'll just say that, we did see a plateauing of cases before the holidays. That was very reassuring. And we did expect to see a reduced testing over the holidays, which we did see, and many other provinces saw exactly the same. And our test positive rate has remained between 7 to 9%, hasn't come down. So that shows us that while our case numbers are coming down, test positive is still high, so we need to be very careful entering into the new year. All the good things we did over the Christmas, we need to, stay the course over New Year's Eve and long weekend, celebrate, limit ourselves to our household, connect with others virtually on New Year's Eve, ring the new year in virtually. But then, it's a nice weekend for most of Saskatchewan, meet and greet friends and family outdoors and up to groups of 10. Being outdoors, I think I have never seen so many people outdoors in the last many years as I've seen over the holidays. And I think it's great for you and your family to get fresh air, to meet and greet others in a safe manner. And then as we go back to school next week and go back to work, I think we need to really keep practicing everything we've been doing, entering into the holidays, through the holidays, and into January, because that's going to be really important. So, I hope with all these measures, I hope we don't see a spike in January, and that is exactly the reason why all these measures are in place, to prevent the large spike that the modeling was predicting we could see even over the holidays, which we didn't see, or over January, which again, we really need to continue to work to avoid that. And then that allows us to start going back to school for those who can't work from home, to go back to work. It keeps everyone safe. It keeps our health system not under immense pressure, although even now, while our hospital cases and ICU cases are not rising, but they are high. So, healthcare staff have been working throughout the holidays. But I think that will allow us to then manage the next 3 months. I think next 3 months are going to be critical, January, February, March. And then once we get into April, May, the weather opens up, there'll be more vaccine, and then hopefully it'll be a different situation. But I think the next weeks to months are going to be really important for us to stay the course.
Follow up, Lynn?
Yeah, kind of jumping back to the AstraZeneca vaccine. Do you already have a plan in place for once that's approved, like how many doses Saskatchewan can expect to see and where those are going?
My understanding is that Canada has secured contracts with 7 providers, and for AstraZeneca, it's for up to 20 million. But obviously, we don't know the details of what the timeline for those doses will be once it's approved by Health Canada for use in Canada.
Thanks very much for joining us today, everyone. That concludes our time.